In Lincoln and in Nebraska, there's a need for healthcare workers. So Bryan got together with Lincoln Public Schools and they worked on developing this program where we can get students lots of experiences that they normally wouldn't have in their everyday classes, while also getting some college credits to get a jump start. It's a big deal for these students to be able to do that. In each lab, we've got 4 beds, 2 mannequins in each room, so the students can interact with the mannequins. They can also have patients in the bed and interact with each other. We've got medical equipment all around us. The cupboards are full. We brought the students to the college this semester. They got to experience sonography, go up into our sim center, and see what it's like to be a college student learning to become a nurse or a sonographer. And I think that's a great experience for the students. One of the first assignments I had them do was a personal statement. And I wanted to structure it like, okay, why are you coming into healthcare? Why do you want to become a healthcare provider? So I got to hear the background stories and get an idea of what they wanted to do. As juniors in high school, they'll be certified nurse assistants, so they could go out and get real life experience working. That's something that they could use in their college essay when they're applying to colleges. We bring in people from the hospital, different healthcare workers, and show them, yeah, you don't just have to be a nurse. You don't have to be a physician. We have EMTs, paramedics, Bryan's volunteer coordinator, just so they can see that for a hospital, for healthcare to work smoothly, you gotta have a team. These students grew up in Lincoln. Most of them have. They're in school in Lincoln. We want to keep them in Lincoln. So we're working to have funding so they can have scholarships when they come to Bryan. We have spots reserved in our programs for these students. So we're trying to make Bryan the college that they choose to, that they want to go to.
My grandma and my cousins got in this really terrible car accident when I was about 8 or 9, and my cousins were really struggling. They're my little cousins, and I felt bad for them. And that's what drew me to want to go into pediatrics. And when I heard about this opportunity, I think my 8th grade year, I was like, I'm gonna do that when I get to high school. My favorite class is CNA. I like doing hands-on stuff, so our skills labs are really fun. We just get to learn stuff that nursing assistants would perform, turning patients, feeding them, and taking output. Just an overview, basically. It's kind of exciting, I guess, that there's just so many opportunities to grow and develop from such a young age. So I think having the experience at 16, 17, compared to having to wait until you're at a nursing school, at a med school, when you're in your 20s or so, you just get a lot more groundwork. I would like to thank the people that made it possible. I'm really grateful I had this opportunity.